afternoon. Good afternoon. Good afternoon. It is 1:31 p.m. Eastern Standard Time in the afternoon. 13:30 for those of you who are into the 24-hour clock on Friday, April 7th, year 2023. My name is Mark Kulak. This is Houstonic Live, Houstonic.live, broadcasting from the Boston area. And today's show has a research channel, research, data collection, archival collection, channel. And today's show, brought to you by someone who was in the data storage industry for 22 years, 23 years or so. Today's show is going to be reviewing some content that we covered a few days ago. Actually, it was in the Sunday evening show of this prior week. And in that show, we covered, we put forth the evidence that within the United States of America in the year starting in late 2019, early 2020, the production pipeline for the antiviral known as Remdesivir, made by Gilead or GS5734, that the production pipeline of this product was fired up before the trials even began within the United States of America. For several people, that was spine-chilling information. It is really spooky to think that there really is evidence of premeditation with this product. If it had been something that, say, had been used for years or centuries, like even ivermectin or an antibiotic, a vitamin, something, right? Something which had a long history of working for a variety of things, that would be one thing. But no, there was a lot of effort invested by top levels or very high levels in the United States government to fire up the production pipeline on a product that never worked for anything. Not just never tried. I mean never worked. And I mean never worked as in, well, people didn't get better. I mean never worked as in people died. Now, just because there were trials which were so bad that people died, that doesn't mean that there may not be any utility at all to this product, Remdesivir. That's not what we're saying. What we're saying is it had no track record of success. It was only speculation. And with all of the things which we had known that could have worked, those were just ruled out entirely. Matter of fact, there were efforts placed on calling everything which had worked in the past conspiracy theory because this was novel. Okay? And you can just look at the research papers to see who loved using that word novel. And they are saying different things these days that they may have not have said that. Regardless, I wanted to review this evidence. There was a longer show on Sunday, and it was a lot of chat, and I knew that I would probably get a strike in its totality if I left it on the channel. So I made a decision to cut the whole thing down. Yesterday's show, I'm about 40 to 60% done with the edits and the cleanup. I will have that posted by this afternoon or this evening. And that was reviewing the reasons why Remdesivir became the standard of care for people who were diagnosed with the COVID-19 disease in the United States of America. Again, we are a very U.S.-focused show. I just can't look at every country. I mean, the data within my own country is bent and corrupt enough. There's simply no chance to understand the different types of corruption and information, or I should say narrative bending in every other country in the world. So why bother? I can barely get my grip on my own country. So this was a really important part. It wasn't planned to be like a key part of the Sunday show, but I wanted it available for you. Now, if you're looking for a document that says outright, right up front, that Rick Bright or BARDA started to manufacture Remdesivir before it was needed. I don't know that. I mean, I haven't seen every article out there, but there may not be anything that says it quite that explicitly, at least not in the headline. So we're just going to review the evidence, which, if there's truth to it, would support the statement that the remdesivir manufacturing was started early, that the pipeline was put into movement early. And in fact, we can even show that there is evidence that going all the way back to 2017, there was a peculiar fascination with more study of remdesivir and maybe adding it to the United States Strategic National Stockpile. The United States Strategic National Stockpile is where we, United States, keep our extra vaccines, therapeutics, vitamins, Band-Aids, whatever masks is related to. We keep it in a stockpile, somehow distributed throughout the United States, protected to be ready to go should there ever be a regional emergency that requires large amounts of certain types of medicines or therapeutics or et cetera. As a U.S. citizen, I'm not objected at all to some people with the United States government pursuing such a thing should there be an unexpected active nature that would lead to this event. It could be fire, tsunami, volcano. I'm dead serious about this stuff. It's not a bad investment of taxpayer money, and to have some governance with that. Unfortunately, in this case, most of those people wouldn't be benefiting at all from remdesivir. Only people who happen to be experiencing a novel virus, which, we'll just, we won't even finish that sentence, but you know what I'd like to say there. So this is a live show, and I'm hoping to just leave this one as is on YouTube, on my live channel for at least a day or two. I will... There's a couple areas where I'm going to have to boogie a little bit to not state anything that's too overtly against the censorship. But I'd like to leave it up for a little while, and then just put the same copies on the other channels. I'm already at least one video behind on editing and putting up a cleaned up version on. So I don't want to have too many videos taken down and then having to repost. So give me a second here, and I want to... Why is that not locking in? Oh, come on. Are you serious? Boy, this machine is going slow over here. Just give me a second here. I just want to open up the chat and have it open on the side here. I see 27 people live. That's pretty cool. That's pretty darn cool. I didn't see anyone else broadcasting or doing a Twitter space. I don't like to stomp on other people's feet. Not to mention, there's a few other channels that I always want to listen to too when they're streaming. I'm the same as you guys. All right, so let us begin this little escapade here. How we doing? RT3, good to see you, Deborah. Rock Girl, Spike the like. I like it. I like the spike. I like the way that phrase sounds. Maple Syrup, good to see you as well. You guys are the best. You guys are the best. You guys are the best. Okay. Now, so we're going to read a few different articles, browse through them at a high level. We don't believe in, I don't use whistleblower evidence. I don't believe using secondhand evidence. This person said, I overheard this, whatever. I've been in a situation before where I was privy to seeing some things, and it doesn't really add up to a hill of beans. All it does is it may help another researcher become aware of things that they need to look for. So all the stuff we have in here is public sources, most of them, matter of fact, even mainstream sources. It's not like we're quoting InfoWars, all right? Very, very seldom will you see me, no slander to everyone at InfoWars, but very seldom will I use something like that as a source. So let us go to the Remdesivir page, and the article I know I want to see. I think it was from Business Insider, and it came out sometime around, I think it was like summertime. Let me see if I can find this puppy here. I'm pretty sure it was a Business Insider article here. Here we go. Yep, it's Bloomberg, actually. It was a Bloomberg article. So this is a Bloomberg article from May 14th, 2020, guys. Okay, May 14th, 2020. I'm going to downsize a little bit here. Ooh, I'm already kind of downsized. I'm going to downsize a little bit more. Okay. May 14th, 2020. Bloomberg. The title of the article is All Eyes on Gilead. Last year, Thomas Gilead, and by the way, if you just want to have a visual here, this is Thomas Gilead, born 1967. This is who this person is referring to. He's from the old Czech Republic area. Last New Year's Eve, Thomas Gilead, vice president for discovery virology at Gilead Sciences Incorporated, received a disturbing email from a top infectious diseases expert at the University of Virginia. The researcher had been working with Gilead on a plan to test the Gilead drug Remdesivir as a treatment for Middle East respiratory syndrome, a deadly disease caused by a coronavirus. MERS had been flaring up from time to time in Saudi Arabia and elsewhere since 2012, but this email, New Year's Eve email, was about something more ominous. These were cases of pneumonia suddenly emerging in Wuhan, China. Watch this one, the virologist warned. It might be a new coronavirus. Remdesivir was one of the few experimental medicines that had shown promise in a lab studies against a wide variety of coronaviruses. It did? Well, we've seen those papers. Narrator's note, we've seen those papers, such as the ones written by Barrick, and the promise was if it's used very, very, very early, dare I say prophylactically. Those papers said that if you use it late, there is no promise. Interesting how they keep ignoring that in these articles. Narrator's note ended. Like the rest of the world, Gilead knew next to nothing about this new one, meaning the new pneumonia breaking out in Wuhan. The World Health Organization hadn't yet confirmed there was sustained human-to-human spread, and the extent of the outbreak in Wuhan wouldn't become clear for weeks. How would they know? Nobody knew at this point whether it would become a pandemic, but Gilead started planning on the assumption it could. Within weeks, Chief Executive Officer Daniel O'Day performed a task force to study how to test Remdesivir and, if it worked, mass produce it. So this is suggesting that they were starting to think about mass producing this and reviewing the need to mass produce it on New Year's Eve. Can you imagine getting a phone call that someone has the flu, one person, and a few people have the sniffles on the other side of the planet, and you shouldn't, and actually investing like $1 billion or whatever it is to fire up the production machines and more studies based upon such scant evidence? I'll tell you what, most executives that would do something like that would be fired. They wouldn't survive. That is a ridiculous assessment, but that's the narrative. Even by the exacting standards of pharmaceuticals, Remdesivir is tricky to produce. The months-long process involves 70 raw materials, reagents, and catalysts. The resulting active pharmaceutical ingredient, standing API, is a white powder, 1.1 grams, of which constitutes a single 10-day course of treatment. Remdesivir is administered intravenously, which introduces additional complexity into the manufacturing. The powder must be dissolved into a solution and then placed into a glass vial under sterile conditions, or placed into glass vials, Thanks to its work on Ebola, Gilead already had a small supply of Remdesivir on hand. How fortunate! Sitting in cold storage in Switzerland and California were enough 30 milliliter vials of the drug to treat 5,000 people. which made it possible to begin human trials in the United States, China, and elsewhere. So there just happened to be the perfect amount of excess hanging out in a freezer somewhere next to the ice cream and the Bud Light to run all the trials. How convenient. In a factory in Edmonton, Alberta, Gilead had 100 kilograms of the bulk white powder, perhaps enough to treat 90,000 patients. Isn't that another home run coincidence? There just happened to be enough powder sitting in a few drums out behind the laser tag place or wherever it is they keep the stuff to make another 90,000, just enough for the next round of patients in the early trials. Just enough, with just enough time between the powder in the keg to ship it and to get it into the glass bottles. Just enough. That's beautiful, Gilead. That's just so beautiful, baby. To fill enough Remdesivir vials to treat millions in the pandemic, however, such as in the summertime, would require a metric ton or more of the bulk drug. So, imagine you have this product, you have 70 ingredients, it takes 9 to 10 months to make. If there isn't action taken at this time, there is no way there would have been Remdesivir available for all the hospitals in New York City in the summertime of 2020. Right? It's pretty simple. So, but America, the United States, didn't even have its first patient until June 15th, which wasn't even given compassionate use of Remdesivir until June 23rd, which didn't end until started January 23rd and ended January 29th. Not to mention, we didn't even have a trial. We didn't even have a 50-person trial yet against coronavirus and Remdesivir. So, even let's just say there was the compassion use patient 0, right? And then there is a trial with, let's say, a few hundred people. If those things wound up being successful, we wouldn't know that until end of February of 2020, which means if this product takes 8 to 10 months to make, it's not going to be available until December 2020 or January of 2021. However, because it's never really been used effectively with humans against anything, and because there's thousands of things which have been used with a variety of illnesses, we treat symptoms, not genetic codes, right? We treat symptoms and not genetic codes. When did hospitals make that transition? You go to the hospital, you have a fever. When the body has a fever, when it detects that there's a microbe swimming around and it wants to raise the temperature and kill it. You don't go, gee, we should do a gene sequencing of the bacteria to see what's going on here. You go, no, the body has infection. Usually, right? Not all the time, but usually that means that if you can give some antibiotics, the person more often than not would respond favorably. You don't need to gene sequence the little bugs inside the body to figure out what's going on, right? Right. So in this case here, there needs to be a rule that, well, because it's novel, so incredibly novel, obviously nothing else could ever work. And with the production pipeline being as long as it is, there's no way that they could have had 8 to 10 months after the first trial. And I don't mean like a 10,000 person trial. I mean like a 100-person trial. However, it would be, thinking logically here, it would be irresponsible to start firing up 1,000 different types of drugs that have never been used effectively with any person, that, as a matter of fact, were so bad that they actually wound up killing more people than survived. Why would you start making something like that so early? Not to mention, I'm sure that there have been other drugs out there which have worked poorly. Which one do you choose? You just choose one. You throw a dart at the board. Do you do all of them? Well, let's continue here. So, to fill enough Remdesivir to treat millions in the pandemic, however, would require a metric ton or more of the bulk drug. Gilead didn't have close to that and still doesn't. So, back in January, it ordered more than a dozen of the most crucial starting materials and reagents from suppliers in China, Europe, and elsewhere. In January. Gilead also helped its contractors locate sufficient supplies of compounds needed to start making those materials. Gilead fired up the production timeline in January. Now, knowing that there's thousands of different things which they could try, why this one? Why? Gilead has thousands of different compounds. Why this one? Why that one? How many other companies fired up production at that scale of their antivirals at that time? Why so early? However, it still wouldn't have been done. So there's a little bit more to this, guys. There haven't been a lot of stories of foresight and preparedness in this pandemic. This is one. I'm so thankful, Bloomberg. After a big trial sponsored by the National Institute of Allergy and Infectious Diseases, Remdesivir was authorized on May 1st for emergency use on COVID-19, the disease caused by the new coronavirus. Dr. Anthony Fauci, the director of the NIAID, has likened the trial of Remdesivir to the first big trial of AZT, the first drug on HIV. Anyways, if you ever, let's just say, compare Remdesivir to AZT, and if someone says that's conspiracy theory, you can just say, well, Bloomberg actually quoted Fauci comparing the success of Remdesivir to AZT. Those are Fauci's words. As AZT was, Remdesivir is being authorized for a wide use before it's fully clear how effective it will be. In other words, we need to assume that vitamin C is lethal. However, we must also assume that Remdesivir could help until it shows it doesn't help. Until there's a trial that shows Remdesivir is bad. And by the way, given the fact that Remdesivir can be used really early on someone exposed to a virus-like particle, there's always a way to get data that shows that Remdesivir isn't bad if you use it the wrong way. See, isn't that beautiful? Isn't that just a sweet little trick that Remdesivir has? So, because of this dual nature of it, right? Because of that, there will never be a test, ever. That at least not by these insiders, that shows it's bad. And because of that, it will remain the standard of care while people talk about fifth-gen warfare, while people talk about Barrack, while people talk about China, while people talk about this and while people talk about that, and you see in talking about Trump and talking about Biden and talking about a million other things, this stuff is going to remain the standard of care because the very same people who were involved in making it so want you distracted, and they don't want you to talk about Remdesivir. They're even willing to let you talk about the vents now. Just don't talk about the Remdesivir. Preliminary data from the 1,063-person trial show the medicine sped recovery in the most serious cases of COVID-19 by about 4 days. That is the most bizarre metric ever. So in the serious cases, if you stop counting the people who died, they might have been released 4 days versus the people who didn't get it. And you also need to look at what else these people were injected with, because it wasn't 100% controlled. It's the most corrupt trial that's ever been run. And Fauci knows it. And Rick Bright of BARDA also knows it. Full details haven't been published. The doctors just have to run with it. That's awful. And a smaller trial in China didn't find a benefit. Well, there's a beautiful way of saying it. The smaller trial in China didn't find a benefit. Well, in fact, the smaller trial in China was the same number of people. It's just that they stopped getting people stopped showing up sick. They couldn't fill it. But the people who did show up sick, guess what? They had more deaths than lives saved using Remdesivir. I guess one way to say that would be Remdesivir seems to be killing people. But I suppose another way of saying it would be China didn't find a benefit. Sort of like saying, I can't find a benefit of hitting my knee with a crowbar. I can't find a benefit of sticking a hot skewer into my eyeball. I just can't find one. The Food and Drug Administration, in granting emergency authorization, didn't allow Gilead to claim the drug as safe and effective for COVID-19. The agency said only that it's reasonable to believe the medicine may help. The FDA never said that, as corrupt as they are, even they wouldn't say it's safe and effective. All they kept saying was it could help. Fauci says, well, it might help. Everyone said it could help. It might help. We can't find that it doesn't not help, using twisted trials and ignoring the trials from China, which seemed to unequivocally show it was bad. It's just hilarious. O'Day says it, and this is the logic. O'Day says it's not a cure. It's a first step, but it's an important first step. Many additional drugs and vaccines will probably be needed to stop the pandemic. Maybe, but guess what? You won't be able to take them unless they bless it. He says Gilead itself is working on an easier to administer inhaled form of remdesivir that might be useful for less severe cases. Wonderful. So you give people who are totally asymptomatic and probably not sick something that they can inhale to make more evidence that the drug is safe and effective. I see how this works. I see what's going on here. But, and again, we are reading a May 14th, 2020 Bloomberg article titled "Emergency Approval of the Antiviral Drug Remdesivir is the First Good News in the Pandemic." This is how Gilead scientists prepared for the moment. Now, a couple more paragraphs here is what we need. But with few other medicines available and the number of COVID-19 cases continuing to grow steadily, about 4.3 million cases and 290,000 deaths at press time, the drug is likely to be in high demand until a better treatment or a vaccine is available. Remember, Warp Speed wasn't until May 15th, and Fauci and Bright are on record saying that it was going to be 1.5 to 2 years before the vaccine came out. As of this time, the plan was 2 years of remdesivir. Can you believe that? These people, these scientists, were going to reward us with 2 years. 2 years of remdesivir. That was the plan before Warp Speed. If you think Warp Speed was bad, never forget the plan was 2 years of remdesivir before the vaccines saved us. Now, the vaccines, you think the vaccines were going to work? You bet you're behind they were going to find a way to show that they were effective. Curiously, though, you probably would have still seen people dying in their sleep, maybe keeling over at a basketball game. I wonder why. Of course, all of those sudden deaths would have been blamed on coronavirus. You do know that, right? Because they would have all tested positive for coronavirus. They wouldn't have been blamed on a vaccine injury because the vaccine, there's no way they would be injecting the vaccine into anyone, right? They were going to wait 2 years. We were just going to have 2 years of remdesivir. There's no chance, because these people are so ethical, there's no chance that they would have injected mRNA or DNA vaccine into people, which maybe would cause them to test positive for COVID. And if they died, mark it down as a coronavirus death. That is the most absurd thing. And I know that never would have happened. Gilead plans to donate the first 1.5 million vials, enough for 200,000 patients. The number depends upon dosage, blah, 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 blah. This will be delivered in the spring. Wow. So Gilead fired it up, decided to, just for the heck of it, fire up all of their manufacturing for remdesivir and to give it away. Wow. How do you even respond to that? And it would be delivered by spring. By fall, a much larger supply should start to become available, and Gilead is working with other unnamed companies to bring factories online overseas. The question is, can Gilead make enough of it for the whole world? This is just insane. So, of course, they talk about 25 different chemicals, all the different tricks to the manufacturing. Let's see here. Now, this is some more stuff. I see some good comments on here. The calculations, blah, 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 Kent and O'Day, on the need to order more raw ingredients and other supplies right away to prevent bottlenecks. This is back in, okay, I have to go back a little bit now. There's a lot of good stuff here. Depending upon how you count, there are about 25 chemical steps in the production process. Most drugs require about half that number. Some of the steps are more delicate than others. An early one uses a reagent so flammable it will spontaneously combust if exposed to air. That sounds like something you want injected into your body. Another involves a poison called trimethylcysylcyanide. Yes, it is. It does say cyanide. If you get it on your body, you better get yourself to the hospital really quick, and you might still not survive. Wow. There's a chemical that goes in it that's so toxic that if it gets on your body, it will kill you. However, during the process of manufacturing remdesivir, okay, afterwards, we are supposed to believe that not only should we get it on our body, but we should inject it into our bloodstreams. Wow. Holy moly. Now, I've been, and I'm going to remain, it doesn't really matter, by the way, exactly what remdesivir boils down to. If it boils down to cyanide, if it boils down to Cyclone B, if it boils down to cranberry juice, orange juice, battery acid, whatever. The high level, if you look at the data, it's correlated with bad outcomes, especially if it's used late. I ask you, please do not focus on the key agents of properties of remdesivir, and the how it compares to other chemicals and other poisons. Please don't do that, because you're turning the argument into, well, remdesivir is correlated with bad outcomes, to if you can just prove that remdesivir is in snake venom, obviously I'm debunked. Don't fall into that trap. Please don't fall into that trap. Now, of course, it's important how the product is made and to study it and so forth. Of course, that's important, but but it's sort of like going to trial with a murder charge, and instead of saying, well, here's the video of Joey stabbing Jerry, you actually get into the details of how Jerry died of organ failure after the blade went in. Why does it matter? One guy stabbed another guy. That's the key idea, right? Okay. So Kent estimated that without improvements in the process, it would take 9 to 12 months to take a batch of remdesivir from scratch. This is where I get the number of 10 months. 9 to 12 months to make a batch of remdesivir from scratch. So if they didn't start making this stuff until after the trials, it wouldn't have been around. That includes a few months for suppliers scattered around the world to make the raw ingredients, 6 months for Gilead to assemble the ingredients in the precious powders, and a final month to finish and package the drug at a filling plant in Laverne, California. The calculation led Kent and Ollier to brief O'Day on the need to order more raw ingredients and other supplies right away to prevent bottlenecks. O'Day signed off immediately, Kent says. At the same time, Kent assembled a team of 20 chemists who started working on ways to speed up the manufacturing process on both remdesivir powder made in Edmonton and the starter chemicals made by Gilead's contractors. Eventually, they instituted tweaks that reduced the time to manufacture the drug to 6 months. Isn't that amazing? And somewhere, not mentioned in this article, though, is that it was actually Rick Bright on that team that led that effort to carve 2 months off. So every time there seems to be just enough distance to make it difficult to get remdesivir into the arms and into the bodies of everyone who needs it after the trials are done, there's always a way to shorten the time to explain why there's always enough remdesivir in the hospital to inject into people. There was never a remdesivir shortage. Think about that. Ever. No hospital ever said, sorry, you're going to have to wait a few weeks for the remdesivir. There was always enough. As complicated as it was to make and as expensive as it was to make, There was, and as soon as the authorizations came after the trials, there was always enough of the product. How is that possible? Unless there was a coordinated effort to ensure the pipeline was in place. So even this stuff here, like they don't mention here the details of, well, there just happened to be barrels of powder hanging out somewhere in someone's locker, in the back of someone's Ford Pinto. There just happened to be, $50 million of raw ingredients just hanging out. If you're working in a company and if you spend millions, tens of millions of dollars on a raw ingredient that winds up not being used, you get fired. You lose your bonus. You can't pay for the in-ground pool that you want to put in your house. You're screwed. You can't do that. This means that the top levels of this company somehow, and I don't mean starting in January, I mean starting in, let's be honest here, August of 2019, at a minimum, there were already efforts to acquire the tons of ingredients, the dozens of ingredients, and manufacture the product up to the point where the powder was sitting in kegs. Why would they do that? Why was there such a coordinated effort, a premeditated effort to manufacture so much remdesivir before it was trialed in anyone for coronavirus? Why not anything else? Nothing else. Remdesivir. Why? And there was always enough for everybody. And if you know it takes 10 months, and if you know it takes months just to get the ingredients together, there's no explanation for that other than total premeditation to have the pipeline going. We know from looking at the extensive whistleblower complaint between Rick Bright, the director of BARDA, who, by the way, is overseeing the contracts of Robert Malone for nearly 10 years. Okay? We know that from that whistleblower complaint, and maybe this is not where's the best page for me to have that information here? Probably in the famotidine trials. Yeah, the whether or not famotidine was. This is the extensive Rick Bright whistleblower complaint filed April 20th, 2020 against his boss Robert Cadillac. Rick Bright of BARDA was demoted effectively for insubordination. It was really about remdesivir and famotidine, really. Somehow Cadillac got $20 million, $22 million to trial famotidine. And Rick Bright, one way or another, wound up transferring control of this $20 million famotidine contract to Alchem Chemical, where the person he was subcontracting, Robert Malone, was overlooking it, at which point the trial went off the rails and failed. Now, I'm not sure if famotidine was really helpful at all. Some people say maybe at high levels if it's injected, but who the heck knows, right? But there's also a constant theme in this 75-page whistleblower complaint about Rick Bright also being in disagreement with his boss, Robert Cadillac of ASPR, Secretary of ASPR, about the benefits of remdesivir going back to the fall of 2019. The Cadillac wanted to invest in this antiviral EIDD 2801, I think, from Emory University, which effectively was eventually manufactured by Merck as Malnirapur. I can never pronounce it properly. Who really cares at this point? And Bright wanted remdesivir, always. And they got into a lot of tension about this, a lot of arguing. But no sooner than the emails start coming from China, as we just read from Bloomberg, December 31st, 2019, that Rick Bright and Gilead were already collaborating on getting the production going. Now, not only did they get the production going at that time, remember, somebody somehow already manufactured barrels of raw ingredients that were just sitting around somewhere in the freezer next to the ice cream, in someone's house, sitting behind the printer paper. Who does that? The answer is nobody does that. That was a premeditated move. Don't tell me it was left over from the Ebola trials from 4 years ago, 6 years ago. That's baloney. That's a lie. I'll call that out as a lie. And if it was, well, you just assume it's fresh still? Something that, if it gets on your skin, will melt through it, sort of like the scene from Alien. Like Reese gets hit and, his chest is on fire and the other guy's arm falls off. And you're going to let that sit in a barrel somewhere for a few years and it's still going to be okay? Seriously? Are you serious? No, it was premeditated. This was a premeditated effort involving multiple people. Now, I don't know everyone, and I don't know who the ringleader is, but we sure know that Rick Bright of BARDA was a key person, and other executives, at least a couple of them at Gilead, must have known. There is no way that their papers, that their balance sheets would have been looking favorable with tens of millions of dollars of raw ingredient just being made for no apparent reason and hanging around. This was all premeditated. And knowing, okay, so let's just say they took a bet. Why didn't other companies fire up and spend tens of millions of dollars on speculative products? Why were we banned from using vitamin C, vitamin D, spring water? People were treated with such abuse. People were fooled into thinking that this virus was so novel and deadly that you couldn't even have your family with you to hold your hand. Who else worked with Rick Bright on this? Well, I definitely know Sina Bavari of USAMRIID was a very, very big player in advocating for Remdesivir for everything. Especially novel coronaviruses, probably coming from China, which caused a pandemic, which were zoonotic and leapt off a bat, through a camel, onto a person in a wet market, where Remdesivir was most likely to be the thing that would work. That's exactly the paper that he wrote, and that is one of the papers which was used as justification to start the trials, as well as this computation work done on programs at the Defense Threat Reduction Agency on platforms like Domain. So I'm not going to do too much more. That's 45 minutes. That's a lot of content. I'll look at comments for a few minutes here. All right. I just wanted to be clear. If you want to know where this narrative is being created from, go to my site. Look at the timeline that we have for Remdesivir. We mapped out, and if I don't know exactly the date something happened, like if it says that Rick Bright did something in January, I'll say estimated date, EST. Some of these have links to content. Some of them, I just have a static link, or the link may not work. I'm working on a million different things at once here. But the evidence, this isn't just speculation. This is hard evidence. Okay? And again, we don't know. The word evidence of itself doesn't mean that a statement in the evidence is true, right? I mean, if I wrote, on this paper that I am the King of England, well, I could say that this paper is evidence that I am the King of England, but it doesn't mean I'm the King of England, right? So these papers, this whistleblower complaint, these articles from Bloomberg, these press statements that came out of HHS, they're evidence. And all the evidence points to Remdesivir pipeline being fired up absurdly early, nonsensically early, so early that it must have been premeditated. Now, if it turned out that Remdesivir was saving every life it was injected into, that would be one thing. I would say let's start handing out bonuses and awards. But it hasn't. it hasn't been represented properly, and the fact that it's been used late has resulted in a lot of deaths. And if it not for those deaths, there never would have been enough panic to justify any vaccines. Every vaccine injury, every vaccine death, in the United States at least, is only possible because of the authorization of the drugs in the first place. It doesn't matter if DOD made them. It doesn't matter if my mom made them in the kitchen. It doesn't matter who made them. It doesn't matter if they were made right or wrong. Every single vaccine injection happened because of the panic that was created by the number of people dying in that summer for a variety of causes, including isolation, including suicide, including authorizing crap like this. If you want to talk about lot numbers and vaccines, fine. However, there would have been not one vaccine injury if not for this. You know what I'm trying to say? You know what I'm saying? Nah, mean? All right, guys. Oh, thank you. Thank you. Is it my research? You know what? I'm just collecting data. I work very hard at it, and it takes a lot of time. All right. Is it my research? It's your data. It's our data. It's everyone's data. It's out there. It's not mine. It was a lot of work to put together. And you know what? There's a lot of things in my life I wish I've done, other sacrifices I made that I haven't. So this is one that I'm doing. Doesn't make me a hero. I know that many of you have done things which are far more heroic than anything that I've ever done. So this is our data. This is everyone's data. And this is what it says. There's no spin on this at all. It just is what it is. There is no other explanation for any of this. Nah, I mean, yeah. Do you know, dystopian, do you know what? No, this is the story. Do you know what that's from? I'm actually quoting who's the guy? I can't think of his name right now. He filled in for The Daily Show. As a stand-up comic, I thought he was really brilliant. He's from a South African guy. And like the brilliance of "do you know what I mean" being reduced to "na mean" is one of the most beautiful tricks in the English evolutions of the English language of the last 20 years. Hey, happy Easter to you, and happy Easter to everyone else in the chat as well. Please, everyone, have a blessed weekend. Please spend some time with the family. Take a break. Spend some time in the house. If you're a guy, if you're antisocial, work on the house, because you know what? Your house takes care of your family, right? That's an indirect way of doing it if that's what you need to do. Let's see here. The great meme of old book volumes. Let's just say effery, advanced effery, and super advanced effery. That's brilliant. Wild tangent. Shelf stable is a thing. It could be shelf stable. I mean, look. I mean, how many of us have like an old bottle of cilantro, right, or like seasoning, crushed, onion powder? And trust me, you've moved. You've done like 2 moves. It probably goes all the way back to college. And you're like, well, the bottle says 10 years, 14 years ago, I can still use it. But that's onion powder. This is stuff made with cyanide products that's being injected into people. It's a different standard than the old spices in the spice drawer. It could be shelf stable. However, that's an assumption. If the product's never even been used successfully, I mean, knowing if it's shelf stable is like another level of knowledge, right? It's sort of like first you test if the airplane can fly, and then eventually you test, well, how long can the plane remain unused without deterioration of the seals, engine components, and stuff like that. That's like the next level of testing. So they just went for it. I think. Maybe. Look at a few more comments here. It's still good, man. Exactly, Paul. Sometimes it's just good enough. It's just good enough. You just go for it. Take a break, Mark. I'm taking a break right now, Ed. I am going to. We have a birthday party here tomorrow for a family member, so I have some stuff to do, and I just wanted to get this out there today to keep the pace up. I felt sad. I felt as though I deprived you guys by taking this part down from the Sunday show. It's really important. This is really, really a key statement that this pipeline was in the works. Things changed. Remember, Warp Speed, they threw the schedule off. There's a lot of curveballs here. This thing did not go according to plan. The evidence suggests something very, very dark and nefarious here. I could be wrong, but the evidence looks very bad. And that is a neutral statement. It's not for me to come up with a positive spin on it or ignore it. It's not for us to do that. It's just for us to put this out there, and people can digest it, and then figure out where to go from here. All right, guys. So thank you very much. God bless. Isn't Ramadan happening too? I don't follow over the religions. I'm not a universalist. However, I respect all people. But that's a whole nother story. We all must baseline. We all must respect each other. We're all born with our flaws. We're all strange. We're all messed up. And usually the biggest problems is usually in the mirror and not with the other people. So with that said, I need to get outside, and I got some stuff to do to get ready for this weekend. Take care, everyone. God bless. Love you very much. Thank you for joining. I'm going to leave this up unedited for a while, for at least a day or so. If it gets a strike, so be it. And we'll be streaming again. I'm going to try to keep the streaming pace up, maybe at least once a day for a little while. Okay, guys, take care.